Over the past 25 years, I have interacted and met so many patients, many of whom have impacted my life. Today I will share stories who have impacted me the most. This is Gayatri. Gayatri and her sister came to me for a routine health checkup about 18 years ago. When I was looking at her slide under the microscope, I found evidence of cancer. So I picked up the phone and I spoke to Gayatri asking her, "Do you have any symptoms?" She said, "I'm just feeling a little under the weather, but nothing more than that." So I called her back and I collected a fresh blood sample and rechecked it. That also confirmed that, yeah, she does have cancer. Later that evening, when she came with her husband to collect her reports, I disclosed that she has acute myeloid leukemia or blood cancer. I recommended that she go and see a hematologist in a hospital that I knew. The hematologist, being very competent, understood the urgency of the condition. He suggested that she go and get a bone marrow transplant done at CMC Vellore. Fortunately, Gayatri and her husband took their advice, went to CMC Vellore and got a bone marrow transplant. Today, after 18 years, Gayatri is cured of a cancer that otherwise has a life expectancy of few weeks from the date of diagnosis. Imagine the impact that it will have in bringing down the healthcare impact to that individual, reducing the healthcare impact to the family, and reducing the impact to the society. This is what I call unburden your health or unburden healthcare. Now imagine if the same proactiveness, prevention, early detection, picking up disease at an early stage was to be applied across the country. Imagine number of diseases that would be picked up at a stage where you could actually prevent or even reverse them. Imagine the impact it would have in reducing the healthcare burden on our country. Healthcare in our country, as our previous speaker spoke, is very reactive. That is the reason why, because it's out of pocket, that people tend to only use healthcare when they need to. My endeavor is to change the life cycle of a patient. Go to a doctor to remain healthy. Don't go to a doctor when you fall ill. I want to ask you a question. Have you ever encountered a situation in the city of Mumbai where you need an appointment of a top doctor in a top hospital? Those 15 minutes of consultation, but you were told that you'll have to wait for a week or a month or even more. Maybe a show of hands? I see at least half the room putting up their hands. Yes, the healthcare burden is extremely skewed, and more skewed is the gap between demand and supply. Like the West, India is also becoming dominated by non-communicable diseases. But unfortunately, we have less than one doctor per 1,000 population to meet this need. There is a growing need, but there is limited access to quality healthcare with less than one doctor and one bed per 1,000 population.